Choosing the right time to have a joint replacement is actually a really difficult problem to solve.
A series that gets to the heart of health matters. Narrated by our medical, surgical and clinical specialists.
If you're struggling with hip or knee problems, having the conversation with your GP or physiotherapist is a great starting point to look at options that aren't necessarily surgical.
Well, when your knee starts to cause problems with your lifestyle, you've got to think about what's going on. If you are having pain all the time, if it's waking you up at night, if you can't walk a distance, if you're not going to a party because there's nowhere to sit, this is starting to interfere with your lifestyle. As you get older, your knees cause problems for a number of reasons. Sometimes it's in relation to the fact that the way your knees are. Think about the cowboy with the bow legs, they wear out on one side. Sometimes it's all those old injuries that cause derangements inside the knee. And sometimes as we get older, we're just a little bit overweight and we wear out our knees. Should you have one knee replacement or both at the same time? This is a very individual option for people. Some people are not that fit and they need to go one at a time. Some people are very fit, have limited time constraints or conditions that mean they need to have only one operation. I think the benefits of having a total knee replacement on both sides is that you get up and going in a shorter period of time. But you have to weigh that up with the risks, and if you have certain conditions, you're not suitable to have bilateral, that is both sides, knee replacements.